had this boy, 15-year-old boy coming from Ethiopia, and we had a tie-up with that government. And so he had a back deformity which was crooked in the upper back, and in general terms, like it was coined by one of our senior professors, we call it Anaconda Spine, because the spine is so bent, like his neck will not be seen before. So what is scoliosis? So scoliosis actually is a Greek term, means the spine, if you see from front, should be a straight line. But if you see in scoliosis, they will be with a crooked spine to the lateral curvature, that's to the side. So there is also, so you saw that it's kyphoscoliosis. Kyphosis means exaggerated forward bending. So the people with forward hunchback is called kyphosis. So this is the medical term we use. So scoliosis is lateral bending and kyphosis is forward bending. So this boy had both kyphosis and scoliosis. Normal scoliosis, as we know, is more commonest is idiopathic, where the cause is not known. So if the cause is not known, we call it idiopathic scoliosis, and more commonly it's seen in adolescent age group, especially girls. Girls 10:1 is the boy ratio. So a disease of the nervous tissue, it's a genetic disorder. So maybe grandparents or somebody had the disease who did not have spine. So the neurofibromatosis is disease of the nerve tissue, but it affects the bone that it starts bending. Even your leg can bend. So this boy had a bend in the spine. So this was him. This is what he looks like. The neck is into the trunk. So surgery, I think he would have himself forgotten now how he looked, right? So this is what his X-ray was. So you can see at the top end how crooked the spine is. So in the spine, which is nearly 110 to 120 degrees. So when you see such high spine, what happens is there is less. You can see the lung space here. There is no space for the lung. So the lung has a backward pressure which exerts on the heart, and you can see the heart, which is supposedly on the left side, has moved to the right side. So there is less lung. There is a back pressure to the heart, which causes heart failure. But luckily in this boy, he just has developed some back pressure in the lung. He came with breathlessness. He can hold breath less than 15 to 20 seconds, and then he cannot walk or run faster, but he always dreamed to be a football player. So when we try to do traction film, that's what we try to bend the spine and see whether it is bending before surgery. So there was no movement. Traction film or a bend film, the scoliosis will correct. That is called flexible scoliosis. Here it had become so rigid that it was not bending. Then we sent for a 3D printing. So this is our in-house. We have the department has an in-house 3D printing facility. That's, I think, the only hospital in Chennai which has this facility in-house. So we do a technician who does the printing. So it is like doing modeling. Like any model you can make out. This is a synthetic model of his spine. So this was his spine. You can see it has gone there and like a hairpin bend.
Actually, SIMS Hospital, Orthopaedic Department, one of the best, not in India, I'm sure in Asia, or even in the world, because headed by very experienced. I've been here in Tamil Nadu more than 25 years. I worked for 18 years with Miyot and 5 years with Apollo and 5 years now with SRM. I'm very proud that most of my patients, especially ortho patients, they've been here in SIMS. Most of them, they go back happily, and the success rate is very high actually. And now we believe in God, and we believe in our doctor actually. Every patient, when this patient, they start inquiring about his treatment, many centers, they refuse to take this patient because it's very, first of all, the risk is very high because it's scoliosis, and moreover also, he's very young and he's growing, and then he have a problem in future for the lungs because his breath will not be there unless something done. Because when he's growing, the lungs is getting tight. So in the near future he can lose his life. So when the inquiry come from Ethiopia, then we check with our senior doctor. They say let see the patient, because when you send the X-ray, MRI, you're not sure exactly how the patient condition. But they feel that if we can do something for this patient. So when the patient here will meet the doctor, so Dr. Appaji says, we'll try to give life for this child. We should not just hurry to tell that we cannot do anything. This is a good thing here. They'll try to give life for the people. So then they said they'll put him in traction, and we'll see after that if there is chance, because the surgery is very actually high risk and anything can happen, and he can lose his also functioning totally. Then he back again, he says, surely we'll do the surgery and surely we'll give him a life back, and we save his life because the lungs is going to be breathed normally and he also can have his normal life. So that assurance make us happy, even sister becomes so happy. Everyone at home, they're very happy that at least we give him chance for life. And now after surgery done, everybody is happy. I appreciate really doctor and the management for even giving good life for them, because she delivered just now here because nobody can accompany the patient. But she's in the last month. Sally says there's no problem. Raju Sally says let them come, let deliver here and we can take care of the child. Thank God and thank the management, thank Dr. Appaji and his team, and we are very proud about India because the treatment in India has become too advanced. Doctors are very good. That's why you can see so many number of foreign patients that come to India to get treatment. And thank India for that also. Thank you so much.